Good afternoon, everyone, and welcome to this Together SC call. Is our association health plan right for your organization? I'm Ben Bullock. I'm the Vice President and Chief Operating Officer for Together SC, and I am also a member of the Association Health Plan Trust that was started in order to get this plan off the ground. With me today is David Slade. He's our broker for the plan with Marsh & McLennan Agency up in Greenville. And before we get started, I just want to do a quick overview of sort of how we got here. One of the things that Together SC was charged with when it was started in 1996 as the South Carolina Association of Nonprofit Organizations, one of the things, in addition to putting on a statewide conference for nonprofit leaders, which we have done for 26 years, I think 26 years, yeah, and advocating on behalf of the nonprofit sector, which we have been doing for 26 years. The third thing was create an association health plan. And we weren't able to do it at the time, and in the regulatory environment remained unfavorable for quite some time until about a couple of years ago. And we were approached by our friends at the United Way Association, and particularly the United Way of Greenville, um, who were floating around the idea of creating an association plan. And they came to us and said, hey, Together SC, you are the statewide network of charitable and philanthropic nonprofit organizations. Can you do this? And we worked with David, and we worked with Blue Cross Blue Shield, and with some other folks, and determined that yes, in fact, we could. It was feasible to create an association health plan that would be available for our nonprofit and philanthropic members. I am really proud of where we have come so far. It's been just over a year and a half since the plan was launched. And I don't want to steal David's thunder about the numbers and how many folks we've got in and how we're doing. So I'll save that for him. Um, but I want to welcome you all to this information session. And if you would please put your name and your organization in the chat box. And if you've got any questions that pop up during the presentation, please be sure to put those in the chat box as well, and we'll try to answer them. And with that, I will turn this over to David Slade with Marsh McLennan Agency. Hello,
Great.
David.
Great. Thank you, Ben, and good afternoon, everyone. I'm David Slade, Marsh McLennan Agency. Thank you for joining this session today. And we want to kind of make this informal. We have a shorter presentation, but most importantly, we're available afterwards or in the chat to answer any questions you might have. So, we want you to consider whether the association health plan might be right for your nonprofit, because it's worked for a lot of Together SC members so far, and we have a lot of activity. A lot of people are taking a look at it. So a quick overview of what we wanted to address today was to, once again, I think Ben touched on this, what are Together SC's objectives and what were the objectives of putting together the association health plan. Talk a little bit about the health insurance landscape. It's ever changing. Talk a little bit about the association health plan background. Talk about how we've performed so far. It's been about a year and a half. Review some of the options that are available to you, and then really go over how you can get a proposal, what the process is, and then talk about other opportunities along the way. So as Ben mentioned, Together SC started about 26 years ago. And one of the major reasons to start it was to tackle high health insurance costs that are faced by nonprofits and pretty much all groups, all industries, all sectors. It's a challenge that everyone's dealing with. And the goal was to offer affordable, easy to manage employee benefits to help nonprofits, philanthropic members with employee recruitment and retention. We all know it's a very competitive job market out there, that we want to retain the employees that are valuable to us right now, and actually recruit and retain those folks who we need down the road. And this is available to nonprofits who are as small as 2 full-time employees. So you can qualify for this plan at 2 or more employees. It's group insurance. We're just attaching you to a larger group plan that Together SC is sponsoring. And this is a hot topic. So 50% of all survey respondents recently said they didn't offer healthcare. And I would say about 30% of the groups that are coming into the association health plan are offering group health insurance for the first time. So that's a major accomplishment. We want to collaborate and support other nonprofit association members and partners. And it's also another option for those who are unhappy with the current health plans or unhappy with the premiums they're paying. So that's, a good number of folks out there based on the health insurance environment we're faced with. So what are some folks saying? So we thought this is a really great quote from Molly Talbot Metz, who's the president of the Mary Black Foundation in Spartanburg. They have 8 employees. They joined the association health plan. It was June or July of 2022. So Molly said, for the first time, we can offer staff 2 options: a high deductible health plan and a traditional plan, similar to what was offered previously. They consolidated vision, dental, and health into one plan with one card that's easier for the staff, and it's consolidated billing, so it's easier for Mary Black Foundation to administer. Both the staff and organization saw cost savings, and their net annual savings was about $5,000 a year. So a little bit about the health insurance landscape. You're probably well aware of this. You hear it, you see it in the papers, talk to other nonprofits, talk to other companies. Unfortunately, premiums continue to rise at an alarming rate. We're now seeing about a healthcare trend, medical trend of about 8% a year. Medical's about 8%. We're seeing drug costs can go as high as 12%. Some employers are dropping coverage, or they are passing on greater shares of the costs to the employees in terms of a higher percentage of the premium. And then folks are having to make plan design changes, larger copays, higher deductibles, higher out-of-pockets. And some of these are driven by the Affordable Care Act. So unfortunately, the economics don't work. You have the average American worker earning about $17 an hour. That's $35,000 a year. And then if you look at 2022 survey plan numbers, the average cost of single coverage was about $7,900 a year, and the average cost of full family coverage was $22,500. So we're looking at some pretty significant numbers. So the value of the association health plan is we're able to create some very competitive employee benefit options and connect smaller nonprofits into a larger group plan. So we offer a lot of flexibility in plan design and pricing. It's a very strong employer member benefit. If you belong to Together SC, it's probably one of the key benefits that you get from the association if the plan makes sense for you. We take over all the compliance requirements because we're partnering with Blue Cross Blue Shield and Capstone Administrators, who does all the billing and reconciliation for Blue Cross on all their association health plans. So, Blue Cross has been administering association health plans for over 30 years. So this isn't a new concept. Many other industries have association health plans. So you have them for car dealers, home builders, maritime association, medical association. So there are many different AHPs out there. Blue Cross has been a leader in this field. So that's why we wanted to partner with them and create a turnkey solution for nonprofits where it makes sense. So how do AHPs lower cost? Once again, we're taking small employer groups, we're pulling them together to lower administrative costs and improve efficiency in administering benefits. We're also pulling together into a large group single employer plan for rating and renewal underwriting. So that's helped a lot of groups. We're also pulling a lot of groups out of the ACA small employer market, where basically all your rates are based on the age of the member and where they're located. We can look at everything like a large group health plan. We can look at gender. We can look at gender, age. We can look at zip code, and then we can do some basic underwriting. And sometimes that really helps employers get better rates than just paying the community rate that say a Blue Cross or someone else would come up in the small group market. And then we've had lower renewal cost trends. So we see cost trends typically to single digits, where we're seeing on all size groups some renewals that are single digits, but a bunch of them are going higher than 10% or even in excess of 20%. So you don't see that in the association health plan as much as you see in the regular marketplace. And association health plans have demonstrated consistently lower cost trends over the last 10 years. So a little bit about our performance that we're proud of, and Together SC has done a great job in promoting the plan to members and non-members, because we've also had a bunch of people join the association just to access the group health insurance. It was started in January 2022 in partnership with various United Way chapters. Right now, we have about 28 Together SC member groups participating. Those contacts are on the website. We have about 260 covered employees over an 18-month period. Originally, when we started this, they said, hey, you'd be doing well if you had 100 employees in 12 months. So we've well exceeded that. It's actually the fastest growing association health plan that Blue Cross Blue Shield has. So we're getting many kudos for that. About 30% of the groups that are participating in the AHP are offering group health benefits for the first time. So that's been really rewarding for them. And along with the health insurance, we're able to offer other products such as flexible spending accounts for healthcare or dependent care. We're able to offer health reimbursement arrangements. So that's a program where you could buy a higher deductible plan and then reimburse your employees a portion of the deductible. And then for those groups that are offering a qualified high deductible health plan, we can do HSA administration through Accrue, who's one of Blue Cross Blue Shield's partners. And we've also expanded into other benefits. So we offer ancillary benefit options through Mutual of Omaha. So like we're doing on the health insurance, we're able to get more favorable pricing on basic life and AD&D, voluntary life insurance, voluntary term life, short-term, long-term disability, and then some voluntary benefits such as accident and critical illness, all available through Mutual Omaha, all on one bill through Capstone administrators. So they could really consolidate your benefit offering. So it makes it a lot easier. And, once again, all the AHP trustees are nonprofit leaders. So they're looking out for your interests, and they're overseeing the plan and the relationship with Blue Cross and Capstone. So a little bit about the underwriting process and options. It's pretty easy to get a proposal. All we need is basic census data, your current plan summaries and rates. If you're offering group insurance right now, if you're not offering group insurance, it's basically just a census and an underwriting questionnaire, general employer questionnaire. So it's pretty simple. If you have less than 25 employees, we need you to answer, or employees to answer, a one-page employee health statement, except if you're a current Blue Cross client. So if you're currently a Blue Cross group health client, you don't have to answer the health questionnaires. But if you're a non-Blue Cross client under 25 employees, it's a one-page health statement. So it's just a couple basic questions, and the employee signs the bottom of it. They could shoot it directly over to us at Marsh. You know, once again, you don't want to see your employee's personal health situation. If you're over 25 eligible employees, we don't need the health statements. You could just submit a census with basic demographic enrollment information. We have a lot of flexibility in plan design options. We have 18 different medical plan design options that include traditional PPO copay plans with a prescription drug card copays. And then we offer several qualified high deductible health plans that can be paired with a health savings account. We also offer 2 dental plans and 1 vision plan. And then you can choose any of the 2 of the 18 plan designs to offer. So you could offer a base option and a buy-up, and you can get creative with the plan designs. We are targeting 75% participation after valid waivers. So a valid waiver may be someone who doesn't want your coverage due to spouse coverage, someone who might have Medicare, Medicaid, TRICARE. Those are all valid waivers. So if you had 10 employees and 4 people had valid waivers, Blue Cross would want to get 75% of 6 employees. So they're pretty flexible on the participation guidelines. And then once again, we have 20 different rate tiers in the association health plan. So it's not that every group's getting the same set of rates on the 18 plan design options. We have 20 different rate tiers. So, and it's not based on size. So we're seeing some small accounts get some pretty good lower rate tier offers. So we're really looking at each group individually, which gives us more flexibility than what you get in the traditional small group marketplace. Here's an example of the 18 different plan design options through Blue Cross Blue Shield. This is the major group division. So we have PPO copay plans that go with deductibles as low as $500 up to $4,000 PPO copay plans. You see a variation in coinsurance goes from 80% to 50%. All the PPO copay plans have primary care copays, specialist copays, urgent care copays, and then we have a standard prescription drug card copays, 3-tier, and Blue Cross uses Optum Rx as their prescription benefit managers. We also have qualified high deductible health plans that can be paired with HSA accounts. And then we have 2 what we call health incentive account programs. These are pretty cool. This just says that if you have a member who does 2 wellness activities, for example, they go for a routine physical exam or OBGYN well exam, or they fill out a health risk assessment on the Blue Cross Blue Shield website, they'll get a credit towards their deductible of either $500 on this plan or $750 on a $3,500 plan. So it's really up to the employee as to whether they want to get engaged and get a credit on their deductible. Some of our more popular plan design options include the 50% coinsurance plans because they're priced very competitively. Most people don't hit the deductible on a group health plan, but if they do, this gives you some pretty significant premium savings. We have a $2,000 deductible option, 50%, $4,000 deductible, 50%, office visit copays, 30, 50, 50 to 100. They both have prescription drug card copays that pay up front. We do have a $4,000 high deductible health plan that has 50% coinsurance. That's our least expensive high deductible plan. And then I talked about this health incentive account with a $3,500 deductible where you can get a $750 deductible credit if you get engaged and do 2 wellness activities. And then a traditional, say, $1,500 deductible 80/20 PPO copay plan. We have 2 dental options that are through Blue Cross Blue Shield. Very competitively priced. Everybody gets the same dental rates, so your dental rates don't vary by group. We have a high option plan where the single rate is $29 a month for single. It's 100% on your preventive, 80% on your basic, 50 on major. Has $1,000 dependent orthodontia benefit. Has $1,000 annual max per person per year on the regular dental plan. And then we have a leaner option that's priced at about $22 that reduces your benefits if you go to a non-participating dentist. And if you stay in network, you get richer. Most people go with option 1, but option 2 is also available to you. And we also have a vision plan where it's through Blue Cross Blue Shield, but we're using the iMed network. So iMed's one of the largest national vision networks available to you. You have a $15 copay for an eye exam, $15 on contacts. You got allowances on your lenses and frames, $110 allowance on your frames, $110 on your contacts, and the single rate's only $4.38, goes up to $12.84 for families. So very competitive vision rates. So the request for proposal, you can complete the interest form on the Together SC website. You just ask for your name, your organization, approximately how many employees you have. That information is sent over to me at Marsh McLennan Agency. I will reach out to you for an initial call. I like to talk to people first before we generate a proposal, so we know a little bit more about your nonprofit and what you're looking for and what may be a good fit. We then get the proposal back from Blue Cross Blue Shield. Once you send us all the information, typical turnaround time is about 2 weeks from the time we send it off to Blue Cross to the time we get the proposal. And then if you want to come on board and join the plan, usually we're aiming for a 2 to 3 week lead time. So if you wanted a 10/1 effective date, hopefully we'd have decision by September 10th. But we're very flexible, and we've gone to the end of the month if we need to. So it's just a matter of trying to give us as much lead time to get your employees into the system and get ID cards out to them. And then you don't have to be a Together SC member to get a proposal, right? You have to be a member if you join the association health plan, but groups that are interested can get a proposal if they like it and they want to join the association health plan, then they'll have to join Together SC as a member. So the opportunity is to really spread the word about this new great member benefit that's available to you to help you with recruitment and retention of your talent, which is a challenge for everyone. So we talked about all the benefits available through Blue Cross of South Carolina. We have ancillary benefits available to you through Mutual of Omaha. We also want you to be aware of all the other benefits that are available to you through Together SC. You have retirement plan options from Mutual of America. You have an employee assistance program that's available through First Sun. This is a benefit that we're getting a lot of inquiries into just because the level of stress out in the workforce is the highest we've seen in a long time. So behavioral health care, mental health care, substance abuse treatment is top of mind for all employers. Nonprofits and every industry is focusing on helping their employees out based on what everyone's experienced the last couple of years. You also have student loan management, public service loan forgiveness program through Savvy. We have Board Strong, which is an online board recruitment tool, which is launched this fall. And then we planning to roll out a compensation and benefits survey, kind of research what the Together SC members and kind of publishing that out to the membership. So we've talked about the Blue Cross Blue Shield options. Blue Cross is by far the largest player of health insurance in South Carolina. They have 2/3 of the market. And then you're also able to access the Blue Card National Blue Cross Network. So you have a strong national network to access if you wanted to go out of state. They also have various savings programs as a Blue Cross member. You have the stability of large employer benefits at competitive rates. As we discussed, we're seeing lower renewal increases in the association health plans than we're seeing on a standalone basis. And, we're very excited about this partnership with Together SC and Blue Cross Blue Shield South Carolina. We've all been corporate leaders in South Carolina for a long time, and our goal is to support nonprofits. And it's a chance to give back, everyone to give back, because, if we get buy-in from Together SC members into the program, that helps everyone. If we band together and for benefits, which is most organizations' second highest cost after payroll, then we're all benefiting by coming together versus everyone going out and doing our own thing. So, we really want to help grow the AHP to get better pricing and stability in pricing year to year. So that is the end of my presentation, which is just shy of 30 minutes. And, Ben or I would be happy to answer any questions that anybody has regarding what we went over.
Thank you so much, David. One thing I wanted to point out is one of the things I appreciate about, as an employee, as a beneficiary of the plan, is the app that Blue Cross Blue Shield has. And of course, the exact name of the app is not coming to my mind at the moment. But
My Health Toolkit.
My Health Toolkit, BCBS Toolkit is what it's called on the iPhone, at least. It's got all the information about your medical, vision, dental plans, your usage, what is your your current deductible status, all that information in sort of like a little dashboard is there. And you can also have virtual copies of your cards in case you forget them in your wallet or whatever. You could just, hold your phone up to the window at the doctor's office, or easily email it to the doctor's office, which I have had to do a time or two. So I find that app very useful and helpful. So going to folks' questions, because I know, some of you may not, and I would be interested in knowing if your organization currently offers health insurance, would you give a thumbs up? And if your organization does not currently offer health insurance, would you give a thumbs down on the Zoom? Love to take the pulse of the room and see who's doing what. We've got a couple thumbs ups. I'm not seeing any thumbs downs at the moment. Oh, we've got a couple thumbs downs. Okay, so David, there's some opportunity here for some organizations that aren't currently offering health benefits. And this is what's important to Together SC as well, of course, is one of our major strategic goals is to improve the and diversify the pipeline of people coming in to work in the nonprofit sector. And one of the ways we are trying to do that is by making affordable and equitable health benefits available to your employees. I know some of the terms that David might have used, like PPO and deductible and co-insurance and all of those things, may seem a little obtuse. So if you're wondering what those things mean, please be sure to ask those questions. Heather Witt is asking, and so is Dorian as well, are there offerings for part-time employees?
Yes, a good question. Our eligibility definition is full-time employees working 30 or more hours per week. So there's some other things you could do if you wanted to, give people, part-time employees, some kind of stipend or something like that to go do their own things. But just like most group health plans, we're defining that eligibility at 30 more hours a week. So good question.
Quintasha is asking, can you talk about the employer costs for the plans?
So the employer cost or the premiums are really based on each individual group, right? So we have 20 different rate tiers. So the rates that are going to be generated by Blue Cross Blue Shield are going to be based on your demographics. So that's the age of your employees, the gender, and the location. And then possibly the health statement if you're under 25 employees and you're a non-Blue Cross client. There's a short health questionnaire that the employees who want the health insurance need to answer. And then we come back with the rates, and they can be anywhere from a tier 1, which is the lowest rate, to a tier 20, which is the highest. On average, we see the rates coming in about tier 13, tier 14. So we help you compare the plan against what you have right now. So we try to make it, a somewhat simple process versus just giving you the proposal. So we'll try to match it up apples to apples as to what you have right now. And then also give you some ideas where, you might be able to make some plan design changes that bring down the cost significantly for the nonprofit and employees. Because we see a lot of people doing the same thing for the last 5-10 years, and their payroll deductions go way, way, way up. And then they look at some of our options, and we say, you could still give people a PPO copay plan with office visit copays and drug card copays, and then you could lower the employee contributions and make it a more affordable option than what you might have been doing for the last 5 to 10 years. So we give you food for thought too, and then share with you what a lot of other nonprofits are doing or what they've done to change it up.
I know one organization said that they with the savings that they got in switching, they passed some of that on to their employees in the form of an increased employer contribution. Um, and if you're interested in, and as David said, he can share with you some of the ways other organizations handle this. Together SC actually has it written into our policies that we have this formula that we use to determine what the employer contribution is, and we work it out every year and budget for it according to that formula. And it's worked very well for us and helped make sure that whenever there are increases, we're not passing the whole of that increase on to our staff. Any other questions coming up? And also, if folks are feeling froggy, they can feel free to unmute and ask your question directly. And otherwise, if you have a question that pops up later in your head, please feel free to reach out to David. I know, David, you had your contact information on the slide earlier, but also it's on our website at togethersc.org/health-plan. Health-plan. Brooke has put the link in the chat box. You can also find that by going to the Together SC website, togethersc.org, and looking under the Join and Connect menu and under Member Benefits, and you'll see it right there, the top option, Association Health Plan. The link to the sign-up form is on that page, as well as David's contact information. And a lot of the information he just presented, and of course we'll be posting this video on that webpage as well. If there are no more questions, I want to thank you all for your time and attention and joining us today. And Brooke is putting in the chat box here. If you don't mind, please fill in the survey. Take this quick survey to let us know what kind of programming you're interested in the future. That link is in the chat box as well. Yuka Greer is asking, is the presentation available? And the answer is yes. We'll make the recording of this available after the call. All right. Well, thank you all very much, and I wish you all a very great day.
Have a good day.